Dr. Nemechek, and welcome to the Nemechek Navigator. This little clip is about just a simple decision of, I understand the protocol has fish oil and olive oil, but should I use inulin or maybe should I use rifaximin to balance the intestinal tract in my child? Simple answer is I pretty much start everybody on inulin with a couple exceptions. Okay. Now, you may know in my reading that the inulin is very, very effective when you're young, and you have less chances of it being effective as you get older. Older meaning, 10, teens, and by 20, inulin doesn't seem to work much. But it doesn't mean it works less. I have, for instance, I recently saw a 16-year-old who's been on inulin for 2 or 3 years. It's working fantastic. So it doesn't mean it doesn't work. It's just that there is a greater chance it won't work at the beginning or might fail. So I generally, though, it's easiest thing to use. It's cheap. It's easy to get. I say, why not start with just the inulin? See how things go. If it doesn't work, you'll know in just really 2 to 3 months. And so I think that's the best strategy for everybody. The exceptions to the rule. We will see some children who are so emotionally dysregulated that they're engaging in self-injurious behavior, or they're really physically harming other people, maybe even to the point of being what you might call violent. Those kids, I just worry about, fiddling around for a few months if the inulin doesn't work and something bad happening. So I'll often start those children off right off on rifaximin, and often on continuous rifaximin when they're that serious, because I'm just worried about the time and what might happen. Other scenarios where I might start rifaximin over inulin, significant cerebral palsy, stroke in a child, and severe epilepsy. And again, the epilepsy cases, I would start the child off on continuous, just that we have to go to maximal therapy because of the danger of this comorbid condition. But that's 1% of the patients I see. All right, maybe 2%. So for everybody else, just start with inulin. Nice and easy. Keep it at a low dose. Don't overdo it. Just follow my guidelines, even if it doesn't seem like a lot. You don't need a lot. And then you can make your decision in just a couple months as to whether it's working or not. We have another video on that. So hope you enjoy the rest of the Navigator. We've designed it with you in mind to try to help solve all your problems. And you all take care now. Thank you.